has this cancerous disease, some 1.5 year back.
We are not sure what it is, and it's completely new, and we are shocked why this kind of situation has come to us.
Scan பண்ணும்போது brain tumor இருக்கு அப்படினு சொன்னாங்க.
She had retinoblastoma in both eyes. In CT scan we got to know that he had a lesion in his head.
The field of cancer is seeing lots of rapid advances as we speak, and the way it's diagnosed, the way it's treated, it's no more the way it used to be done 10 years back. A lot of this research is happening in India, quite more actually abroad, including US and Australia, and I'm very glad that Vineet, having had worked in these kind of centers, bring those experience back to India and treat kids here.
என்னுடைய பேர் ரேகா. நான் வந்து பூர்வசனாவுடைய அம்மா. இவங்களுக்கு வந்து ஆகஸ்ட் 24லேருந்து வாமிட் சிம்டம்ஸ் இருந்துகிட்டே இருந்தது. அது எதனாலன்னு எங்களுக்கும் தெரியல. சைல்ட் ஸ்பெஷலிஸ்ட் பார்த்துட்டு இருந்தோம். அவங்க வாமிட்டுக்கு வந்து ட்ரீட்மெண்ட் பண்ணிகிட்டு இருந்தாங்க. 1 month பிஃபோர் வந்து அவங்க அப்நார்மல் ஆகிட்டாங்க. எப்படின்னா பேச்சு வராமல், கை வராமல், லோ சுகரில் போயிடுச்சு. அப்போ வந்து எங்கள் பீடியாட்ரிக் டாக்டர் வந்து தலை ஸ்கேன் பண்ணி பார்க்கணும் அப்படின்னு சொல்லிட்டு ஸ்கேன் பண்ணும்போது பிரெயின் டியூமர் இருக்குது அப்படின்னு சொன்னாங்க. அப்போ வந்து இது வந்து ஆப்ரேட் பண்ணி தான் இது எடுக்க முடியும் அப்படின்னு சொன்னாங்க. அப்போ வந்து எங்கள் ரிலேஷனுக்கு சொல்லியிருந்தோம். அவங்க வந்து இங்கே ஹாஸ்பிட்டலில், சாக்ரா ஹாஸ்பிட்டலில் ஸ்வரூப் கோபால் டாக்டர் நல்லா பண்ணுறாங்கன்னு சொன்னாங்க.
Myself is Satish, and I'm the parent of my kid Saravana. We noticed that he's having a mild headache from couple of months back. So let it clarified by the MRI scan. So we came to Chinmaya Mission Hospital to go for the MRI scan. So immediately we got it done on the next day. We came back to our physician, and he told as per the MRI scan, they are telling as per the report something is there. So maybe we need to refer to some neurologist. Neurophysician. So immediately he suggested a name, Mr. Swarup Gopal, and he works for Sakra Hospital. So we immediately rushed to for his consultation to show the MRI report.
I'm Manjula. He is my kid. He is 2.5 years old. Actually we started with a fever which was very much continuous. Usually children they'll be getting fever, so we were visiting the nearest pediatrician itself. Then later they told some iron deficiency, and they gave him first iron syrup. After that iron syrup he started developing vomiting. Then it didn't stop. Even after vomiting medicine was given. So then they told by that time he was almost dehydrated. So get him admitted. So nearby nursing home only we got him admitted near Vijayanagar. So then they told to go for a CT scan just to look what's the condition. Then in CT scan we got to know that he had a lesion in his head.
My name is Fatuma Abdi Ahmed. I am from Kenya, a country in Africa. I came to India with my daughter, Anisa. She had retinoblastoma in both eyes. The right eye was advanced and was almost removed in Kenya. but we decided to come to India and look for further treatment, for better treatment for her. We came to know about Sakra World Hospital from a friend called Raj. He brought us here.
Hi, this is Mahidar. So I'm here to share my experience and the deepest sorrows things which we have experienced with my daughter, with respect to my daughter's health, and how Vineet sir and staff has helped us to come out pretty positively from that rough phase of life. So just to give you a background, my daughter, she was she has this cancerous disease some 1.5 years back, and we were pretty much in a tough state. She's just 1.5-year-old kid and how to manage, but fortunately we came to Dr. Vineet, and so he has literally helped us both from medical perspective and from the psychological way of dealing things.
Hi, welcome to Sakra World Hospital, and I am Vineet Gupta. I'm the chairperson here for the Cancer Center, and it is my pleasure and actually privilege to take you through a walkthrough of what we do. We know that your precious angel has been diagnosed with this dastardly disease, and I'm here to hold your hands as we guide you through the process of treatment and curing your child. We have been here in the work of treating children for over 5 years now, and we incorporate a multidisciplinary team incorporating the pediatricians, the nephrologists, the cardiologists to provide your child with the best possible care. What differentiates us from the rest of the cancer centers in the city, in the country, is not just competence, but it's compassion. We understand how difficult it is to see somebody who is your life, your blood and your soul to be suffering from cancer, and we empathize with you in every possible way. So to empathy we bring in great expertise, cutting edge medicine, clinical trials, research work to provide your child with the best possible care. And once your child is cured of cancer, we allow for absolutely wonderful transition so that they mature into adults and live normal, gainful lives.
One of the kids who I ended up treating with Vineet's team was that of Satvik. He's about 3 years old, a very lovely boy who unfortunately was diagnosed with a brain tumor. It was a rare brain tumor, not so rare when it comes to a medical practice, but in general it's pretty rare. And the neurosurgeons here operated it. They kind of took out most of the tumor, and Vineet and their team actually made a very beautiful chemotherapy plan. The course itself was pretty grueling. I think the parents were on board. They really did a good job. And when we did a repeat MRI for him, surprisingly, after a long time, I've seen a case like this where there's a complete remission. So his tumor is completely gone and he's going to be fine. I think from parents' perspective, that's a big deal. And I was very happy to be part of this because I feel Vineet and his team have done an excellent job.
The moment we hear the word cancer, a frisson of fear, anguish and misery rolls through the spinal columns of the most steely of individuals. Obviously, that has to do with the fact that a lot of people think that cancer is a hopeless disease and there is nothing that we can do about cancer. So over the course of next 30 seconds, 40 seconds, I'm going to tell you that while cancer is a problem, I also want to tell you and leave you with a ray of hope to say that lots of cancers can be cured. Most of the cancers can be managed. And there are lots of people who are living wonderfully fruitful, gainful lives despite their diagnosis of cancer. Cancer does not have to mean a sentence of finiteness, of the end. it could be beginning of a new life. It could be a rebirth as well.
We were like very much afraid, like a small kid having such a big condition. Then after 2 days his surgery was done. Then he told it is they have removed it completely, now no need. But he has to undergo chemotherapy. So for chemotherapy still we had a second opinion, like to whether it should be done in Sakra or somewhere. They told wherever you are convenient you can go. Then they only helped us out a lot here, and they told Vineet is the best, Dr. Vineet is the best. So every parent wants their children to give the best, so even we wanted the same. So we wanted the best doctor only to get him cured. Then from last 3 to 4 months we are with Dr. Vineet. He is amazing. Like one good news is after 3 cycles of chemotherapy he was done. 15 days back he was done MRI of the brain. Then they told it is completely disappeared. Now it's almost gone. So we are very happy with Dr. Vineet, with Sakra World, Dr. Swarup Gopal, and even the pediatrician Dr. Sai Shankar. Everyone, Dr. Vineet makes everyone to like be around the children. He is great.
Unexplainable situation, but we have to take a call because this is the initial stage and we don't want it to grow anymore or cause any other effects to our kid. So we started and we immediately admitted to Sakra Hospital for the first cycle, and it was a very good experience with the Sakra Hospital staff and the particular treatment. They have taken care of our kid very well, as if a small baby. We are happy with that. Coming to Vineet Gupta, we have to be thankful to him. He's having a lot of patience, and he knows the kid's psychology as well to some extent. So we are happy that finally we have found a good hospital, and I recommend any other such situation, definitely they can come and have their treatment here.
டாக்டர் வினீத் குப்தா இப்போ ட்ரீட்மெண்ட் பண்ணிட்டு இருக்காரு. ட்ரீட்மெண்ட் ஸ்டில் போயிட்டு இருக்கு. பிரெயின் சர்ஜரி வந்து முடிஞ்சது. ஸ்வரூப் கோபால் டாக்டர் பண்ணார். பீடியாட்ரிக்ஸ் டாக்டர் வந்து சாய் சங்கர் பார்த்தாரு. ஸ்டில் போயிட்டு இருக்கு. நல்லா க்யூர் பண்ணியிருக்காங்க. இப்போ வந்து பேபி வந்து நல்லா இருக்கா.
The emotional support which he has given and the help he has provided us with respect to radiation when my daughter went through in HCG, and the support over there literally helped us actually, and his reputation at HCG has literally kept my daughter in a high priority, and the care they have taken was pretty remarkable. And pretty much it's been one year 10 months or 1 year 11 months, and my daughter she's back to normal and she's going to school right now, and all her daily activities are normal. And we literally thank Dr. Vineet. And last but not the least, the daycare staff, especially Akhil and Jisha. So they are phenomenal in when treating my daughter. Sometimes they had to stop the treatment in between, when she's crying, all the physical problems which we had. Thanks a lot, doctor, thanks a lot.
Dr. Vineet Gupta took Anisa from day one. He treated Anisa with chemo. It was not just chemo, it was everything about this hospital. It was about Dr. Vineet, it was about the chemo daycare team. My daughter got everything, a package. She is better, she is doing well. They managed to save her eyes. As you can see, she can see now. She is playing. The chemo it wasn't even that harsh on her. She was a healthy baby throughout the treatment. We thank God for that. I don't know if there's anything more than saying thank you. We can say that they have been so cooperative with us. They've been so nice to us. They've been with us from day one, not only giving us chemo, but giving us care, love, encouragement, and everything. So the chemo daycare team is our family.
Most of the modern treatments that we have, modern chemotherapies, targeted agents, immunotherapies, and radiations and surgeries, we all work together in a very close-knit, multidisciplinary cohorts that allows the patients to get best of everything. And this is in turn buttressed with psychosocial counselors, dietitians, alternative healers, all providing you with a support system that allows you to go through the trajectory of the disease with a lot of reserve inside you. And what is that we offer at Sakra that is so special? And I think competence, I think that is a no-brainer. But what we bring to the table much more than anybody else is our heart. We treat you like a part of our family. In the US, where I spent more than a decade, there's a saying in Spanish, mi casa, su casa, meaning my house is your house. So when you come to us, we treat you like one of our own because we see no difference. We are because of you. And that is a unique differentiator because cancer is not just treatment, it's also the support during the treatment, through the journey. And some people focus on the destination, and I tell you, it's the journey that matters, not the destination. How long and how beautiful and how arduous it can be, we help you go through that process, helping you continue getting hope even in the most darkest of days. We help you by telling you that while things are looking dark and dreary to you, there is a silver lining. And I think that is what distinguishes us from any other cancer center in this country today, is that we bring our heart, not just our brains, to the table. Thank you for visiting the Sakra World Hospital website. Thank you for taking the walkthrough of Sakra Cancer Center. I encourage you to come, meet us, navigate through what we have to offer, and make the best choice possible for your loved one, because you will get only one chance and you want to be right that particular chance, because cancer often doesn't give you a second chance. We are here to help you hope, to heal, and to integrate back in the society as gainful individuals. We welcome you to visit our hospital and the cancer center here. Thank you so much for your time.